Hello, I'm Nick Freudenberg. I'm a distinguished professor of public health at the City University of New York School of Public Health and at Hunter College. And I'm here to talk about an article I wrote called Keeping the Public in Schools of Public Health with my colleagues Susan Klitzman, Catherine Diamond, and Ayman El-Mohandes, the Dean of our School of Public Health. All schools of public health, public and private, are involved in preparing the public health workforce for our nation and conducting research on the public health needs of our country. And where the money comes from influences who that school is accountable to. And as far as we know, there's not been a systematic look in the past at the differences in schools of public health depending on where they get their funding from, whether it's private or public. Privately funded schools are much more dependent on NIH funding, National Institute of Health funding, than public ones. So what's the problem? Well, NIH funding is largely determined by the biomedical establishment of this nation, and their priorities sometimes diverge from the burden of premature death and preventable illness in the American population as a whole. They're more interested in the basic biomedical science than in solving the population health problems facing our country. As we become what some people call a majority-minority country, where the majority of the population are Black, Latino, Asian, recent immigrants, we need to be sure that our public health workforce comes from those populations. Publicly funded schools tend to have more Black and Latino students. They tend to have more part-time students. And because publicly funded programs have lower tuition, and because they put more emphasis on teaching than on research, they might be especially equipped to prepare that public health workforce the nation needs. Here in the United States in higher education, we are firmly committed to a pluralist approach where higher education is both public and private. And I think that will be the case for the foreseeable future. And both public and private schools of public health play an important and significant role. But I think as the public dollars flowing to both public and private schools of public health increase, we need to be sure that those public dollars are used to support public goals, preparing a workforce to meet the needs of an increasingly diverse population and conducting the research that is needed to improve the health of the population and reduce inequalities in health. And so we need to be sure that all schools of public health are accountable to the public for the public dollars they spend. Students who want to work in community or public health settings should be sure that the schools that they're interested in offer placements in those settings. In addition, faculty in publicly funded schools of public health generally spend more time in the classroom and less time doing research. And therefore, students in publicly funded schools might have more opportunities to interact with senior faculty and to depend on them for guidance and mentorship. On the financial side, private schools generally charge much higher tuition revenues. And so students need to consider what level of debt they're willing to assume in order to pay for their higher education. And those are very different in the public and the private sector. What sometimes happens is students go in with very idealistic notions, but then they come out with a big burden of debt, and that forces them to choose jobs that are the highest paying, which are sometimes not the jobs that most contribute to improving public health.